Welcome to today's video, where we'll be discussing gallstones in depth, a common but potentially painful condition affecting millions of people worldwide. By the end of this video, you'll have a comprehensive understanding of the causes, symptoms, and treatment options for this digestive system disorder, as well as tips for prevention and living with the condition. So, let's dive in. Gallstones are hardened deposits of digestive fluid that can form in your gallbladder. The gallbladder is a small, pear-shaped organ located just beneath your liver, responsible for storing gall produced by the liver. Gall is a fluid that helps break down fats in the food you eat. Gallstones can range in size from as small as a grain of sand to as large as a golf ball. In some cases, they may cause no symptoms and go undetected, while in others, they can lead to severe pain and complications. There are two main types of gallstones: cholesterol stones and pigment stones. Cholesterol stones are the most common type, accounting for about 80% of gallstones. They are primarily composed of hardened cholesterol and may be yellow-green in color. Pigment stones, on the other hand, are smaller and darker and consist of bilirubin, a substance produced when red blood cells break down. When it comes to gallstone disease, there are several factors that can increase your risk. These include obesity, rapid weight loss, a high-fat diet, and certain medications such as cholesterol-lowering drugs and hormone replacement therapy. Additionally, genetics and age can play a role, with those over 40 and individuals with a family history of gallstones being more susceptible. Environmental factors, such as a sedentary lifestyle, can also contribute to gallstone formation. Gender and ethnicity are other factors, with women and certain ethnic groups, like Native Americans and Hispanics, being at higher risk. The most common gallstone symptoms include gallbladder pain in the upper right abdomen, which may radiate to the right shoulder or back, lasting several hours. This pain, also known as a gallbladder attack, can be triggered by consuming a fatty meal. Other symptoms can include nausea, vomiting, indigestion, bloating, gas, and clay-colored stools. These symptoms can significantly impact daily life and overall health, making it important to recognize and address them early on. To diagnose gallstones, doctors may use tests like blood tests to check for signs of infection, inflammation, or obstruction. Imaging studies such as abdominal ultrasound or a CT scan can help visualize the gallstones and assess the gallbladder's condition. In some cases, a more specialized test called a hepatobiliary monoacidic acid (HIDA) scan may be used to evaluate the gallbladder's function and check for blockages. In terms of gallstones treatment, there are several options available depending on the severity of the condition. For mild cases or asymptomatic gallstones, doctors may recommend a watchful waiting approach, where no immediate treatment is necessary but regular checkups are conducted to monitor the situation. Medications such as ursodeoxycholic acid or chenodeoxycholic acid can be prescribed to dissolve the gallstones slowly, although this treatment can take months or even years to be effective. It's important to note that these medications are typically only effective for small, cholesterol-based gallstones and may not be suitable for all patients. Dietary and lifestyle changes can also help manage symptoms and prevent further gallstone formation. A low-fat, high-fiber diet rich in fruits, vegetables, and whole grains is often recommended. Limiting your intake of saturated fats, found in red meat and full-fat dairy products, can be beneficial. Including healthy fats, such as those found in nuts, seeds, and olive oil, can help promote optimal gallbladder function. Avoiding rapid weight loss and engaging in regular exercise can also help reduce the risk of gallstones. In more severe cases or when complications arise, surgical interventions like laparoscopic cholecystectomy, gallbladder removal, may be necessary. This minimally invasive surgery involves removing the gallbladder through several small incisions in the abdomen. It is considered the gold standard for treating symptomatic gallstones. In some cases, a more traditional open cholecystectomy may be required if there are complications or the gallbladder is severely inflamed. After the surgery, gall will flow directly from the liver into the small intestine, which may lead to some changes in digestion. Another option for removing gallstones is endoscopic retrograde cholangiopancreatography, ERCP. This procedure is used to remove gallstones lodged in the gall duct. During ERCP, a flexible tube with a camera on the end is passed down the throat, through the stomach, and into the small intestine. The doctor can then use specialized instruments to remove the gallstones. This procedure is often performed in conjunction with other treatments. Preventing gallstones can be challenging, but there are some steps you can take to reduce your risk. Maintaining a healthy weight, eating a balanced diet, and engaging in regular exercise can all help. Consuming smaller, more frequent meals may also aid in preventing gallstone formation. Early detection is crucial, so individuals with a family history or other risk factors should consult their healthcare providers about appropriate screening measures. To treat and prevent gallstones at home, try incorporating a high-fiber, low-fat diet and staying well hydrated. Living with gallstone disease can be difficult, but there are resources available to help you and your loved ones cope. Support groups, online forums, and professional counseling can all be beneficial for dealing with the emotional and physical challenges of the condition. Remember to maintain open communication with your healthcare team and follow their recommendations for managing your condition. If you've had your gallbladder removed, you may need to make some adjustments to your diet to prevent discomfort. Foods high in fat can be harder to digest, so it's important to consume smaller amounts of healthy fats, such as those found in nuts, seeds, and olive oil. Introduce these dietary changes gradually to give your body time to adapt. As we conclude our discussion on gallstones, it's important to remember that knowledge and awareness are essential in managing this disorder. An interesting fact to consider is that while gallstones are more common in women, men are more likely to experience complications, such as gallbladder inflammation or pancreatitis, due to gallstones. If you found this video helpful, please don't forget to like, comment with your own experiences or questions, and subscribe to stay updated on future content. Be sure to check out our other videos by clicking one of the thumbnails, and thank you for watching.